really been doing a lot of exploring around that like for
Hmm.
parents, like you said, it's not intent, it's not malicious intent, they're just capped off, and
Yeah.
also they're only informed through their lens of their values. So for them, let's say if there is mental health going on for their child or someone else in their life, they're going to be high focus on perceived image,
Yeah.
and how is this going to reflect in society, or perhaps how will this damage marriage prospects? That comes up a lot.
Yes.
And what would you want to say on that topic about image and marriage prospects?
I think that's a really good point you bring up because, like, as we see in our job, a lot of people experience, either diagnosis or waiting for a diagnosis in their
Mm-hmm.
like mid to late 20s, right?
Yeah.
That's when the big life changes happen and the stressors happen, and it
Yeah.
happens to coincide with being on the marriage market.
Mm-hmm.
And I think it kind of
Hmm.
touches on that loki kenge, right?
Yeah.
If they find out you have any family the which a problem hegia, or that you're taking medication for depression, right? Then
Yeah.
it becomes like it becomes really scary, I think, for that generation, right? And then
Yes.
it becomes scary for you as the individual experiencing it because now you're wearing a lot of shame,
Yes.
right? And it's not yours.
Yeah.
And it makes treatment and, like, pursuing therapy all the more difficult.
Yeah, it's just roadblocks and barriers because it already takes so much courage to even acknowledge,
Yeah.
put it on the radar. And then when you're met with that opposition, or maybe they're making you feel guilty or embarrassed,
Mm-hmm.
it's just a deterrent, and it's not
Yeah.
conducive to the healing journey at all. And sometimes in a lot of South Asian families, it's a lot about the facade of a happy
Yeah.
family. Like, keep whatever's going on within the home,
Mm-hmm.
and then that can also create those barriers to getting treatment, and
Yeah.
it's just so challenging.
Yeah, and I think we hear this often in therapy, right? Where we're kind of taught like "Kar de vechiga larko,"
Yeah.
right? And it's like, well, no, like
Mm.
that's not going to be helpful for discussions around mental health because we need to seek outside support, right?
Yeah.
Inside the home, like not saying that there isn't a lot of love there,
Yeah.
but there's not a lot of opportunity for growth because we're
Yeah.
trapped in those same
Yeah.
intergenerational patterns and traumas and whatnot.
Yeah, and so it's like even in any culture, it's sometimes not comfortable to go tell a stranger, quote unquote, your problems, or share with
Mm-hmm.
someone, which is essentially what a therapist is from the get-go. And it
Mm-hmm.
can be daunting, but I think you and I would agree that we're doing this because we care. We're doing
Yes.
that because the shoe's been on the other foot. We know what it feels like to require support
Yeah.
and maybe not be able to find it, especially culturally informed care.
Yeah.
And so we're in this with a desire to create change, be
Yeah.
that support, and that layer of maybe hesitance. Hopefully, we can dispel that pretty quickly in the Therapeutic Alliance. But
For sure.
just for anyone watching, just kind of what is a message you would want to say to them to kind of help them feel more comfortable to go speak to a therapist?
Yeah, I think I would really want to just normalize the experience, right? Like whatever you're going through, I promise you, like you're not alone, right?
Yes.
Whether it's struggling with setting boundaries around with mom and dad around marriage, whether it's getting treatment for your anxiety or depression, whether it's coming to terms with a diagnosis, right? Like
Yeah.
ADHD or bipolar or depression, like you could be going through anything, and I would really want people to know, like, you're not alone,
Yeah.
right? That's what the whole purpose of therapy is, to come and find a safe space to talk to someone about what you're going through.
Yeah, yeah, and it is out there, and I always say that it's okay to keep trying different therapeutic alliances because everybody's personality style is different. What works for one person might not work for the next, and
Yeah.
same goes for modalities. So it's kind of like shopping around, and it's
Yes.
okay to do as many consultations as you want. And